Hey everybody, this is Arun Hariharan, Peds Ortho and Spine Surgeon here at the Paley Institute. Glad to be here. So we thought we'd do a little series talking about the most frequent questions that patients ask us, and we'll just run through a few of them. So one of the most common things that patients ask us is, what is scoliosis? And in the simplest way to describe it is it's a curvature of the spine. So instead of being straight up and down, when you look at a person from the front or the back, the spine actually curves a little bit. And it usually happens in kids around their teenage years, maybe 10, 11, 12. The second most common question they ask is, what causes the scoliosis? And that's a great question. We don't totally know yet. There's been a lot of studies and research continually being done on it. We think there's some genetic cause. A lot of times it runs in families, but the most frequent cause of scoliosis is really unknown. It just tends to happen for some reason in some patients. Now, this is talking about idiopathic scoliosis, but there's other types of scoliosis where kids have an underlying condition or disease, but in idiopathic scoliosis, we really don't know what causes it. And then the third thing a lot of patients ask us is, what are the symptoms of scoliosis? So patients, families, even other physicians really want to know how to pick this up so it doesn't present at a high degree curve like this patient behind me here who came in with a 75-degree curve already. So it can be hard to pick up because a lot of times scoliosis isn't painful, but it can be sometimes. The other frequent things that you find on exam, and usually in your yearly pediatrician well-child exams or in your school checkups with your nurses, is one of the shoulders may be higher than the other. If you look at a patient from the back, their waistline may look different because when you have a curvature, it really shifts your entire spine. And sometimes even when the patient bends forward, you can see the ribs sticking up or the shoulder blades sticking up. So for people like us, it's really obvious, but a lot of times it's not. And that's why it's super important to have these yearly checkups either with your pediatrician or school nurse, or come on in and have us check it out. Number 4 on the list of frequently asked questions is, how is scoliosis diagnosed? So the most common way to diagnose this is just on physical exam. So your pediatrician, your school nurse, or us in this clinic can take a look at you. We have very specialized tests where we bend forward and have you touch your toes, and we look at your back to see if there's any discrepancies in the way your spine is. We can look at you and see if your hips look different or your shoulder blades look different. And this all kind of tells us that there's possibly a curvature. But the best way to prove this is with X-ray. And the X-ray takes a look at your whole back, and sometimes we even get your legs in it, so we know that your legs are equal length and your spine isn't curved because of your legs. And we actually do this what's called an EOS X-ray. It's EOS. It's a super low radiation, high quality X-ray that gets your whole body, and we can even make 3D scans out of it. It's amazing technology and has really cut down on the radiation that many of these children get. Outside of X-rays, sometimes patients need additional studies like MRIs or CAT scans. So the MRI is really important to show us that the spinal cord is all good. And in many cases it is, but we really like to prove it to ourselves. But we don't need that to diagnose scoliosis. And then CAT scans, especially in kids, we want to avoid radiation, so we almost never need it. But there are certain conditions where the bones in the spine from birth don't develop normally, and this is where it becomes super important to get the CAT scans. Okay, number 5 on our list is, what are the treatment options for scoliosis? So this is a big one, and everybody wants to know the answer to this, and it really depends. So I'll start from the simplest to the most complex. So the simplest thing sometimes is you don't need to do anything. The scoliosis is so mild, the child has very little growth remaining, so you just keep an eye on it, and once the growth is over, you have a little curvature in your spine, but it doesn't affect quality of life or activities in any way. If the child has a lot of growth remaining and there's a decent sized curve, and we measure this on X-ray, then sometimes the patient needs a brace. And there's all sorts of braces, but the brace is usually under the arm, above the hips. It corrects the curve to hold it in place, and the main goal of this brace is to make sure that the curve does not get worse. And there are these physical therapy exercises called Schroth therapy, which is super specific to patients with scoliosis. And we have lots of specialists in the area that can really work with patients. And again, the point of these exercises is to work with the brace, to work with the patient's body to potentially help the curve from not getting worse. None of these things really make the curve go away once it's there. except for the final couple options, which are surgery. And really, we save surgery for patients who have really big curves, like this patient behind us here, or have a lot of growth remaining, and we know that it's going to get worse to the point of needing a major surgery. So we do the surgery to prevent any further progression of the scoliosis. So what are the surgical options? The most commonly done one is called a posterior spine fusion. So you go through the back, you separate the muscles out of the way, look at the bones, and really correct the curve, put screws and rods in and hold it in place so that the curve doesn't get worse, and the previously curved spine now looks pretty close to straight. There are newer technologies called vertebral body tethering, which you go more to the side of the patient and put screws in through the front and put a tight rope in, and this is reserved really only for patients that are still growing. Because what this does is it maintains the flexibility, and as the patient grows, the rope holds the curve on one side so that it can grow on a straight fashion when the kids are still growing. It's super cool technology. We're still learning a lot about it. It's not right for everybody, but we certainly think about it when it is an option. So next on the list is, can surgery be avoided? People ask this all the time, even when they come in with big curves. And the answer is maybe. So it really depends on how big the curve is and how much growth the patient has remaining, and sometimes even where the curve is. Is it in the upper part of the spine, the middle part of the spine, or the lower part of the spine? And we really try to do our best to avoid surgery, and this is where things like braces and physical therapy can really help some patients. But in some cases, the curves are bad enough or the genetics are bad enough that there really is no good option outside of surgery to help correct this. Question number 7 on our list of top 10s is, can scoliosis be cured? So this is a very good and important question. In most cases, unfortunately, there is no real cure for scoliosis in that you can't reverse it. In some young patients, putting them in a cast or a brace, if they're super young, has been shown to reverse it. But in many cases, once it happens, our goal really is to make sure it doesn't get worse. And again, this is where our brace and therapy can really help. And sometimes the so-called cure for scoliosis is really the surgery to take that curve away, to keep it from getting worse, and put it in a good position and help the patient live a long, healthy, normal life. Number eight on the list, can scoliosis be prevented? Again, a great question. We don't think that it can be prevented if it is a genetic cause or if it's some sort of syndromic cause, but the best thing we can do for our kids is to catch it early and keep it from getting worse. Number 9 on the list, if my child has scoliosis, can they participate in sports and activities? And the answer overwhelmingly is absolutely yes. So even from the mildest form to the most severe forms of scoliosis, whether you need surgery or not, there really is no restrictions to participating in sports. We have patients who wear a brace and take it off for 3 hours of swim practice or gymnastics every day. We have patients who've had surgery, either the fusion or even the tether surgery, and go back to tackle football, cheerleading, gymnastics, rowing, any sport, you name it. We really like to think that scoliosis is just a small part of who the child is and really doesn't affect their dreams or outcomes in life or what they want to do or who they want to grow up to be, and we can take care of it and let them achieve their dreams in the way they want to. And last but not least on the top 10 list of most frequently asked questions is, what does the long-term outlook look like for patients who have scoliosis? And I'm happy to say that it looks fantastic. We are getting better and better at taking care of children with scoliosis. We have many options in the non-operative and the operative realm to help patients. We've studied this, we've written articles and published on this in major journals. In patients, even in patients who have surgery, long-term outlook, 10, 20, 30, 40 years down the line, looks fantastic. The way they feel about themselves, the way they look, the way they participate in sports, their pain scores, almost everything is better when the scoliosis is managed appropriately. And this means either with surgery or without surgery. So that was some of our most frequently asked questions about scoliosis in children. They're fantastic questions. I hope it was helpful for some folks and parents and children out there. We hope to do more of these about different topics. We'll get into more details about the surgeries, about the braces, about therapy, and also the different types of scoliosis that we take care of and see on a daily basis. This is a really great job and opportunity to help take care of all these children, and see you soon.